Welcome to Dentistry Gone Wild, the official podcast for mobile and teledentistry. I'm Sonya Dunbar, one of the co-hosts.
And I am Melissa, the other co-host. And Sonya and I are just having fun. Today is Monday. We are chatting. We are hanging out. Sonya, how is your week going so far?
Oh my gosh. You know what? I feel like this is a Monday, but I feel like it's already a Thursday. I've done so much in one day. Melissa, getting ready for this conference now. You know, you and I are always on calls and messaging, and I'm already feeling the swell of the anticipation of this amazing conference that's going to be coming. So by the time this is over, I know you love me, but you're going to be so tired of me. But we'll be used to it by then, right?
All right. I would never be tired of you, Sonya. No. But the question, though, the conference is right around the corner, but are you losing sleep over it yet, or is that just me?
Oh, gosh. I'm losing sleep, but the only thing I'm not losing is weight because I'm getting the munchies when I get nervous. So I got to start shaping up. But, you know, I seen something, and this is for me. I was watching the news and it said that exercise and eating healthy fruit does not help you lose weight. So I've been doing it wrong. So that's why I've been, you know, they say don't exercise because when you not cardio. They say lift weights. So don't do cardio. So all that me moving and all that jogging I've been doing, it was in vain. So I'm going to stop. I'm just going to lift some weights around the house and you know, don't eat fruit.
Yeah, and it's like don't drink alcohol either. Like just eliminate it.
Who said that? Who said don't drink alcohol? Now let's just introduce the guest because you're pushing.
That's my New Year resolution.
No. You're pushing. But go ahead.
Well, we are excited. Sonya and I could go on forever, but we're excited to have our guests here today to bring them to you and just have a real conversation, a candid conversation. So we've got two lucky people here today who we get to hear from. We have Dr. Brooke from Idaho, and then she's brought a special guest on. So Dr. Brooke, you are coming live from the hospital. Is that correct?
I actually am, yes. Sometimes we don't know how long things are going to take, and sometimes we don't get to go home for podcasts. So I am here in our patient room. No patient there, though. The patient room's adjacent.
She is masked up. She's got her head thing on. She's got her scrubs on. And, here come the glasses. Those are amazing.
That's so cool, Doc.
Well, Dr. Brooke, can you give us a little bit about yourself and who this special Holly girl is? She's third on my screen here.
Yeah, so I am a general dentist, and I focus on providing care for adults who have special needs and geriatric patients in long-term care facilities. I work a variety of different jobs. I work at a health center called Family Health Services. That's where I met Holly. She is a hygienist at Family Health Services. I do that 3 days a week. We're a federally qualified health center. I started my practice. My practice actually goes into long-term care facilities. We do teledentistry. We do mobile hygiene. We actually do mobile dentistry as well. We've started doing some really interesting things with the pandemic where we call Guided Oral Hygiene. We might talk about a little bit later. But we're doing a lot with the long-term care facility without being able to walk in the door at this point. I also, as you can tell by my beautiful outfit and background, I have a surgical practice where we see people who have disabilities who are unable to be treated awake under general anesthesia. And Holly, who you can see perhaps right below me, because that's where it is on my screen, but I don't know where it is on all you guys' screens. But Holly here, she is a hygienist at Family Health Services. I was very impressed by her, and so when I started my practice, I was hoping that she would have interest in working with me. She did have interest in working with me, so I was very, very happy about that. I don't actually put job things out. I usually scout. That's my favorite way to find, good people to be on my team is I try to hope for them. Well, I couldn't really scout Holly because, that's not legal in the practice, so I was hoping she would because I couldn't scout her. And then she did come to me with a little bit of interest. And so I said, oh, well, then she approached me. And Holly joined our team. She was one of our very first members of our team, one of the founding members of Your Special Smiles. She's made a huge difference in so many patients. She actually cleaned someone's teeth that had never had a cleaning outside of general anesthesia. She was able to clean their teeth on their couch using different behavior management techniques and just her being herself and being awesome. So it's a special treat to have Holly here with us today. And this is Holly Jones. She is an extended access hygienist in Idaho.
Wow.
Hi, guys. My name's Holly, and Dr. Brooke pretty much covered it all for me. One tidbit is I was raised to serve others. And so, long story short, this is my way to serve others that I can't in my normal practice. And so I feel it's my way to just give a part of myself to other people that can't get the access to care. And Dr. Brooke allows us to go in there to help people that need that kind of care. So my name's Holly. Been a hygienist for 6 years and enjoy working on the side to serve this community.
Wow. That is cool. Now, Dr. Brooke, you said you just completed a surgery. You said it was on a special needs patient? Could you tell us some of the challenges that you deal with some of the challenges? Now, let me just back up. I don't know any personal dentist, and I've been a hygienist for, I think now it's 28 or 29 years now. And I have a hard time finding a dentist that really takes time to do comprehensive long-term treatment, like just continuous treatment on adult people with special needs. Usually they get treatment as needed for pain. So when you find a dentist that does, that treats people with special needs a long time, you have to take your hat off to them. And I'm crazy about you. When I met you at the special needs conference, you and I just jived right away. So, but can you just share with our audience some of the challenges and what type of surgeries you do on people with, special needs, and how does that fit in your practice?
Yeah, so our surgical program, what we do is the patients go to sleep under general anesthesia and we get as much done as possible. Our goal is actually not to treat patients. Our goal is to screen them and find a more appropriate place for them, which usually ends up being with me in another modality, because the hospital is the most aggressive way that we can do treatment. So we want to avoid the hospital. But sometimes these people have gone without treatment for so long. Like today I did multiple extractions, multiple root canals, double digits of fillings. And that person is just not going to be able to get treated, especially having to do a behavior management plan to the point that they need to be treated. They're not going to be able to do that while they're awake. And so we had this person go to sleep. We were able to take care of all of their needs, and we had a really good conversation with them and their mom. This patient is able to have a conversation with me, and we talked about preventative, and they're going to be coming to see me every 3 months so that we can do cleanings for them, so that we can put fluoride varnish, so we can use silver diamine fluoride. And our goal is for that particular patient to never have to go to the hospital again, because they'll have good preventative comprehensive care. And so a lot of hospital programs, because we get booked out so far in the hospital, it ends up being, as you said, sometimes just taking care of people as the pain arises and as there's needs. But our program is designed that if you're going to come to the hospital with me, this is like a marriage. Like, this is a commitment, and you're going to keep coming and seeing me, even if we can't accomplish anything. And I tell you, there are people that I can't accomplish anything. Holly's tried to accomplish things on some of them too. And there are some of these patients where even if they come in and all we do is get fluoride on, at least we have that touch point that's regular. And so once you have a surgery with me, I can't enforce that because I can't force people to do stuff, but the protocol is that you're going to then see me every 3 months afterwards.
Wow.
I really like how what you do, Dr. Brooke, is so out of the box. It's so out of the box, pretty much every angle that you take. And that's amazing because it says you can take risk, and it says you're there for those who need it most. And I think, among all the mobile clinicians, among all those who are dabbling in teledentistry, you have to think outside of the box. This is a common theme that we always talk about. You have to think outside of the box. It's not your mama's traditional dentistry, right? Like, to take
Mama.
the words from Sonya. So thank you very much for being a leader and a pioneer, and for somebody who's thinking outside the box and who's being able to adapt in times that need to be adapted to. So I know one of the things that we wanted to talk about was the guided oral hygiene. Holly, will you talk a little bit about that and your role in that if you participate in it?
So Jing Jing is actually the one that's been doing most of that. So Dr. Brooke might be able to speak a little bit more to that. I recently just went to one of our centers and saw some of my patients before I was out for surgery. And so I haven't done as much of the guided oral hygiene, but I do know that Jing Jing has. So Dr. Brooke might be able to speak on that a little bit better, just because I'll be starting into it, hopefully, but with a full-time job, I haven't gotten so much into it. So Dr. Brooke, I'll let you kind of speak towards that a little bit better.
Yeah, absolutely. I'm really excited for Holly to start the guided oral hygiene. We're actually going to start collecting data. We didn't collect data at first, and that was our biggest mistake, was not collecting data, because guided oral hygiene and providing regular oral hygiene services have been the top things that we've been able to do in some of these long-term care facilities, because just the regular brushing and flossing, when that's not happening, we're having problems. And so that's just helping us provide that service. Regular oral hygiene, we had dental assistants, and they were actually, the dental assistant that I hired, they were always hygiene students, and we would hire them to go into the facilities. They would use the patient's toothbrush, they would use the patient's floss. I didn't provide them with anything except for, knowledge and education, and I supervised them for 10 hours before they started, and they had to take a test, all that kind of stuff. We trained them. But then they go into the facility and they use the patient's oral hygiene aids, and they just act as the patient's hands, and they help them get that done. Well, the pandemic hit. And so when the pandemic hit, we weren't able to have those students going into the long-term care facilities, but we saw so many good results having those students go in 3 days a week, brush and floss the teeth. Our first student, her name was Savannah Hendren. She's now a hygienist. Congratulations, Savannah. She graduated. Our second student is Alicia McMurdy, and she has not been able to start because of the pandemic, but we're really excited for her to start with the guided oral hygiene as well. But the pandemic just put a halt to that, because we can't have students going into these facilities 3 days a week when they're also seeing all their patients in clinic and all of this. So what we did was we pivoted a little bit so that we did guided oral hygiene. Jing Jing is on one end for teledentistry, and we've got our little cameras, and they take the little camera, which mouthwash was awesome. Am I allowed to say that?
Yes.
Okay.
Absolutely. We love mouthwash.
The mouthwash was awesome, and they actually donated some Surface Pros, and we had our cameras, and we have our caregiver. So the CNA that's normally taking care of the patient takes the camera and shows Jing Jing what the mouth looks like, and then Jing Jing gives the CNA advice on how to clean that properly. So then they clean it, and then they do an after video, and Jing Jing says, "Oh, you missed a spot over there." Carolina, she is wonderful. She is our CNA. She's been super dedicated with us, and she's been with us since the beginning of this. She's helped us with our regular oral hygiene and our guided oral hygiene. So that's been really great. But Jing Jing goes, I'm only part of it about twice a month. Twice a month I watch the videos. I sit down, I look at everything, I make sure there's no urgent problems. I do like a modified teledental exam. I wouldn't call it a comp exam that I do, but I just watch the videos. If Jing Jing sees a problem, she points it out to me and has me watch the video. But Jing Jing and Carolina pretty much run it. The two of them, they get together and they make sure that the patients in our subgroup where we're doing this pilot project, she makes sure that those patients are having good oral hygiene at least 3 days a week. That's video supervised by a hygienist. And then I just look at that later. My part, the initial, was I did all their med histories. I looked at everything. I wrote up any kind of modifications that they would need. And then Jing Jing took it from there. So that's our oral hygiene program.
So can I ask you a question, Doc, so I can get a clear understanding? So you said you have a CNA that works with you that actually does the CNA work for the long-term care facility, or so you pick a CNA in the long-term care facility, or
actually. So we pick a CNA in the long-term care facility, and they have to work for the long-term care facility. But while they're doing oral hygiene for us, they are not on the clock at the long-term care facility. They come in an hour early, and they are not an employee of mine, but an independent contractor. So she's an independent contractor. I have contracted with her to provide this specific service, and her specific service is to do the guided oral hygiene with.
Okay, so let me get a pause for the cause here. First of all, that is epic. That is epic, because that needs to be everywhere. And first of all, let me tell you how this is a genius idea, because most of CNAs will do extra work. Because when we go in the building, we pay a CNA. We be like, I'll give you a gift card for lunch at Subway if you help us get these patients down to the where we're working at. Get them, So, and most of the time they're doing it on the clock. But to get someone, and I have gone in when I was doing by myself, after the dentist has done an exam, I would go in. I would have a CNA that worked there that was off the clock would help me, and I would just give her something to help me with. But to have a CNA that works for the facility, that's familiar with the patients, that's familiar with the layout of the facility, and to have her as an independent contractor and to take pictures of the patient's mouth, that's what you're saying they do. And then that is amazing. That is something. So, and you call it guided oral hygiene. We're gonna put that into use. That's what we're gonna break out. We're gonna break it out in Florida and Georgia at the top of the year. I love it.
We'll send you all of our stuff. If you want our stuff, it's
absolutely. I love you. You're listen, anybody that's listening to this podcast, Dr. Brooke would share anything. You got an extra kidney? I'm just kidding.
Hospital.
I'm just kidding. Listen, she's such a sweetheart. Now, Holly, I have to put this to you. I don't know the scope of practice in your area, but it has to be pretty amazing working with the dentist like Dr. Brooke, because like you said, she's helping you fulfill your purpose and passion as always wanting to serve the underserved and people in need. So how does it feel to be able to work with the dentist that lets you get your free reign? And could you just give us a visual of what your day look like when you're working with her?
Wow. So first of all, just like inspiration. That's like the top word is inspiration, because she is just a go-getter. She's a go-getter. That I can't even tell you how much I look up to her and want to be like her. And I don't think I will ever meet that goal, because she gets so much done. She's so passionate. Like her passion really just like brings you into her passion to treat her patients, her like the way she is with her patients. So a day with her, some days can be very exhausting because we work on very hard patients, and she never loses her momentum. So I look to her as, just an inspiration to keep me going, to step outside of my comfort zone and my box, because I will stay in my comfort zone and not leave it. I am that type of person. So she gets me to do more with my career. And the place that I work in the public health, I see a lot of difficult patients anyways, but kind of stepping medically complex patients. So I feel like I learn a lot more with her, and she's so willing to teach me. If I will think it's the dumbest question, and Dr. Brooke will answer it to me. If I have a medical emergency, she's the first person I go to. I don't even go to, like, if my other doctors are busy, I go to her. Like, she's the first person I go to, just because she'll jump on a situation and just help you with anything. That's my word, inspiration. And I want to be like her, wish to be like her. I don't think I can ever have as much energy as Dr. Brooke does, but I strive to. I really do. So that, and working with her just teaches me so much. And that's kind of why I like working with her, and getting out of my box pretty much, just kind of, working outside my realm, making me a better hygienist. I've been in the dental field for, almost 17, 18 years. I was a dental assistant, then hygiene school, and then as a hygienist now. And I've just kind of branched out a little bit more. And I just think it makes me a little bit more comfortable to be on my own when I'm with a patient. So that's kind of in a nutshell what it's like to work with her. And then just, meeting cool people and different things that if I ever went to regular practice and one of these patients came in, probably nobody would be comfortable seeing that patient. And now I've had that, that kind of experience with those special needs patients that maybe a typical general practice doesn't see all the time. So it just gives me more experience for the years down the road if I ever go somewhere else. So just kind of cool, and inspiration. That's my word.
That's awesome. So Dr. Brooke, what is the trick what is the thing that drives you, that lets you be so adaptable patient to patient and keep your cool? I mean, let's be real here. Some of these patients may not ever make it to the dental practice, right? So what is the thing that keeps you going and that keeps you so adaptable?
Well, I think having a good team helps a lot. And like Holly is saying, she totally is awesome. She's underplaying herself a ton. Like, there is a reason I wanted her to work with me, and there's a reason she was chosen. Like, it's not random. And so Holly is amazing. Having people like her that are willing to work, that are willing to learn, that want to treat these patients, and who actually like genuinely like these patients is the biggest key. And having a good relationship with your team so that you can rely on each other, because no one can do it themselves. Like, you have to have a strong group of people around you, and you have to have a group of people who are all adaptable and who all are willing to learn. Because one of the big challenges is that you have to adapt like moment to moment. And if you get all worked up about change, then that's really difficult to adapt. And so just having the right people on your team, I think, is big. And also just liking them. You know, liking your patients, I think, is a really big deal. I like all the patients I treat, and if I don't like them, I dismiss them. You know, and there's nothing wrong with not being somebody's doctor. You don't have to be everyone's doctor. I like almost everybody. And so I have had to dismiss a few patients. One of them I really liked, I had to dismiss because there are some behaviors that people can do that you can't have happen in an office place when there's a lot of people, or you can get like sued and such. So we did have to dismiss one patient that I really liked, but really just treating people that you enjoy being around. I enjoy people with special needs, and they can tell their emotional intelligence. If you could measure that, which I don't know if anyone's come up with a measure that they can actually, you know, measure the emotional intelligence of a nonverbal person. But a lot of these people who are nonverbal, who have these, you know, different, what we would call disabilities, have actually enhanced abilities in other areas. And emotional intelligence, I think, is one of them that they really can tell. If you're anxious, they know it, and they're smart. And they might just capitalize on that situation that you're nervous. You know, some behaviors that you see, I always say you want to end on a good note. And you want to end on them doing something that I want them to do. And so you'll have someone have a big meltdown in the office, and that is not the end of the appointment. Because if it's the end of the appointment, you know, mom probably wants to leave because she's embarrassed, or, you know, caregiver wants to leave because they're embarrassed. Patient obviously wants to leave. We obviously want them. So the immediate solution to that is like, let's get out of here. But that doesn't encourage like good behavior in the future. So we let the meltdown happen. If we're in a quiet room, we just kind of shut the door, let the mom and caregiver be there, have no sharp objects, and we come back later. If we're not in a quiet room, we kind of guard from other patients to make sure that they don't leave that room during their meltdown, but they just are able to have their meltdown. They're able to scream. They're able to do whatever. We don't give any rewards during a meltdown, because that's another thing that people like to do when someone's having a meltdown. Oh, here, have this. You know, this will make you quiet. But no, just let them let that emotion out. Once that emotion's out and now they're happy again, I have them give me a high five. That is a very easy task. You know, high five. Oh, good job. Here's whatever, you know, your reward is. Here's a sugar-free sucker. Here's a bracelet or whatever. High five again. Oh, good job. Here's another reward. And then this little reward system, as you build up, then they're going to learn that when I do what she asks, I get a reward. Not when I have this meltdown, I get a reward. So our meltdowns tend to decrease when we don't allow the meltdown to be a rewarded behavior. And getting out of the dentist office for a lot of people is a pretty good reward. And so we want to make sure that they're not leaving because of the meltdown. Now, if somebody's going to get hurt, or there's like incredible profanity and there's children next door, like sometimes we do have to leave the office. But for the most part, we try to focus on just really encouraging cooperative behavior and taking baby steps and just liking them. Even when they have a meltdown, it's just liking them, being like, well, they're just doing their thing. And they'll be better in a minute. They generally will. And I get hit. One of my last surgeries, the nurse had to get the guy off, and he was hitting me good, you know. But that's just something that happens sometimes.
Absolutely, Doc. And you know, you explained that very well. And the way you were explaining it, I could get a visual of that happening. You know, I could see that, you know, somebody having a meltdown, and a lot of people want to reward with sugary, sweet gummy bears or something like that, which is the wrong thing to do. But while you were talking, I remember at the conference last year and how you were there and how you were interactive with your presentation. And I remember thinking that this is something that needs to be on a video, that needs to be something that people could go to and click and watch. And I'm saying this because if there's anyone in the audience that's listening to this podcast, and if anything that Holly is saying as a hygienist, or what Dr. Brooke is saying as a dentist, if that's touching your heart, this may be an area that you may be called to, because definitely working with special needs, working with children, period, working with aging adults, it has to be a calling, because if it's something that's just a job, one, you're going to be miserable, and two, you're not going to do it long, because they're not all pretty days. Dr. Brooks' voice is up, and her personality is cheerful because her joy comes from within her, because the outside elements are not always there. You know, she just said she got attacked, and then she was like, but that happens. I get bit, I get kicked, spit on, called the N-word, but that happens when you're dealing with someone that's 90 years old who was raised in that time and who's mean because he's in a facility and he wants to go home. So I'm excited and I'm happy, but I don't know what's going to happen when I walk into a nursing home. So I said that to say this, Dr. Brooke, have you thought about it, or have you already put, like, just make some CDs that people can, maybe some videos, a series of courses or classes that people could see and hear you present this? Was this is something that needs to be shared outside of Idaho. Send me a potato. But I'm just saying, and I told you that when I first met you, you're in Idaho. I don't know anybody there. And now I know you're there. But are you logging this or chronologing this or something, videoing it? What is that?
We do. We have some little tiny mini videos that are short. We call them short clips and tips. They're on our website, yourspecialsmiles.com. And so we have those little videos. They're mostly like 2-minute videos of just like quick little how-tos. We don't have a lot of them out there. We talk about, mobile dentistry. We talk about teledentistry. I can't even remember what all we have out there, but look at it and you'll see what's there. We're also coming out with a longer series. Our longer series is called the Your Special Smiles Special Care series.
Love it.
It's so exciting. Our very first one that we're going to be highlighting, our first condition is Prader-Willi syndrome. We went with 2 different patients who have Prader-Willi syndrome. Wait a minute.
What's Prader-Willi? You talking fast. What's Prader-Willi syndrome?
So Prader-Willi syndrome is a genetic condition, and when that genetic condition, people have an uncontrollable appetite. And so it's basically like the new term hangry. People say hangry, because they're really hungry and they're mad. Well, these people are in a constant state of that emotion because of hormonal imbalances. And so with Prader-Willi syndrome, these people always want to eat, and they will eat and eat unless it is controlled to where they can't. And so we get into it in some great detail in our special care series as to like what the genetics actually are, what the medical complexities are. But you'll see a lot of obesity, you'll see a lot of sleep apnea, but you also see like anesthesia taking a stronger effect on these people. And so there's a lot of different things that go with that. A lot of them have dental problems, from the frequent desire to eat, but also from enamel hypoplasia. And so we go through each different disability, and our goal is, every 6 months or so to produce one highlighted condition. And we have 2 patients that have Prader-Willi that are going to be starring in this. We go through like a day in their life, and we just walk through, talk to them, interview them. We show like where they shine and things that they're good at. And then we also talk about some challenges that you may incur in a dental profession working with a person that has that. The idea behind it is if you see somebody on your schedule that has Prader-Willi, you could click it. The first 20 minutes are just like straight facts, and you can get what you need for that appointment. But then the second half of the video is getting to know that person as a human and getting to know them. Like, we go to their house, we film them at their house, they show me their stuff. And so that series should be coming out. It's hard to tell how long it's going to take me to edit it, because I've got my fingers in so many different things. And like right when I think I sit down and finish editing it, like I get this call that's like, this thing's going to happen. I'm like, oh, that sounds cool. So then I go over and do that, and then I come back to edit it. So my goal is to have it out by February. We're also doing an ergonomics course, which Holly's one of our stars for ergonomics here.
Hey, Holly.
We had a physical therapist come in, and we said, in mobile dentistry and in special care dentistry, we put ourselves in some pretty compromising positions. And Holly was very honest with Dr. Howard, our physical therapist. She said, Dr. Howard, I can't do that. Like, I can't get in that position, because if I get in that position, this patient's going to get mad because I'm taller than this patient. And so Holly was telling Dr. Howard all the truths of the things she had to deal with, in our specific setting. And then Dr. Howard was doing little tips and tricks on maybe it's not the most ergonomic, but this is better than what you were doing. And we videoed all of that, and we're putting that all together as a CE course on ergonomics in special care and mobile dentistry. So those are
amazing. I can't wait. I don't know about you, Sonya, but I can't wait to dive into that. Yeah.
Right.
And even though, even for clinicians that don't necessarily see and treat a lot of special needs patients, this is still significant information and valuable information to have. I mean, I'm here soaking it up, and I can't wait to just see a day in the life of, that's going to be amazing, because I know one of the things that you've often said, Dr. Brooke, is to see special needs patients not as patients or special needs, but as a person. And that's a huge, for a provider to go into treating a person and meeting them where they are, that's a huge deal. So thank you for editing the videos on your time off and for jumping here and there in all these initiatives and projects. What if there was one piece of advice that you would give to a general practitioner who might see, one special patient, a special needs patient a year? What piece of advice would you give to them?
That you don't have to be an expert to be good at it. Like, you don't have to know everything. There are so many conditions out there and so many medications out there. And there's those of us who are super into it, like myself, but I have mentors that I'll send text messages to. I send emails to. I have to go search things. I have to research these conditions. Like, nobody knows all of that. And so people get uncomfortable because they feel like, oh, I don't know how to treat these patients, but really it's just kind of a love. Like, if you love that patient and you want to do what's best for that patient, then just do a little bit of homework and you'll be able to treat them. And if you don't feel comfortable, email me, email a mentor, find somebody who's really, that you trust, and get some advice. I have a bunch of mentors. I had this patient that's super hard to treat. I have all these mentors, and I consider them some of the top people in special care dentistry. I had one question. I got 4 different answers that were vastly different. All of them would work really well. And so nobody knows everything. Even experts are coming together and giving me very different answers. But with those very different answers, I was able to come up with something that I thought was a good plan for that particular patient. So don't be afraid or embarrassed to reach out to people. That is the only way I ever get anything done is with other people. So have a good team. Have that team be in your practice, but also outside of your practice. Rely on other people and ask questions.
That's amazing. Now, Holly, hygienist to hygienist here. Do you have a favorite patient that you see who's under Dr. Brooke's watch?
Yeah, I do. And his favorite song is is it Bruce Springsteen? Born in the USA. He would be the one that I adore. He's a patient that I had to talk to the physical therapist about, that, I can't do this because I'm if I stand above him, he won't let me clean his teeth. I have to get volleyball knee pads out and bend over on my knees, and he sits on the couch while I clean his teeth. And he was the first one, that challenged me really a lot. And without Dr. Brooke's help, I don't think I could have done it. She was there to help, just distract him. But he was very rewarding, and he's difficult, and some days we get some stuff done and some days we don't. But I look forward to seeing him every time, even though my back is tired after seeing him, and I might be done for the day after I'm done with him, but it makes it for a very rewarding experience. And not to have to put him under anesthesia, it makes me feel really good. So that would be my favorite, I think. But there's so many.
Loves her.
He loves it. See, and some people, they get their favorites and they don't want anyone else to see them. And I like Born in the USA too. So that's a hype song. Dr. Brooke and Holly, this is a question for both of you all to think about. If there's someone listening to this podcast and they would like to start, they noticed in their practice that they're not seeing people with special needs. How could they, one, approach the dentist about having those patients come to the office? 2, how could they solicit these patients? And 3, this is the one that's going to determine, should we just go forward? Can they get paid for the patients? Because Unless they do like a volunteer day, which a lot of offices won't, can they, is there adult, I know adult Medicaid doesn't, it covers residents in nursing homes to a limit, but they'll do they have money with Social Security, or can you just answer just a little bit of those questions for us, please?
You know, Holly, I've been talking a lot. Do you want to answer, and then I'll pick up after?
I think you might be better to answer this question, just because I always guide through you, and you know this end a little better. This is why I call inspiration, because you just look to Dr. Brooke for this kind of stuff, and she's got solutions and answers. So.
Well, absolutely. Like, just willingness to treat these patients. There's no marketing involved. I do no marketing at all. Like, sometimes people will see our website, you know, as they're searching things, they'll see our website or they'll see our Facebook page, and we post a lot of pictures of our patients doing cool stuff. We volunteer with Special Olympics. I think Special Olympics is an excellent, like, foot in the door kind of organization to get yourself comfortable. One of the challenges I think a hygienist might have if they want to bring more patients who have special needs in and the dentist isn't comfortable with that is just that comfort level. And so getting the practice to volunteer for a Special Olympics Special Smiles event will help everyone in the practice become a lot more comfortable with these patients, because we're also going to their area. You know, they're all happy. They're all doing what they love, you know, and they're excited to show you their medals. And we're not doing anything in Special Olympics Special Smiles usually that's invasive enough to elicit a behavior that would be like angry. Some people really don't like you in their mouth, and so we have a few behaviors in there, but not very often. And so it's a very good way, it's a good starting point. We make sports cards for our local Special Olympics basketball team, you know, and I get all of the students at the assisting program to come and help with that. So they all get exposure in a way that's a very low stress environment. And so that's a good first starting point. But yeah, once you start doing it, it's a small community out there, and they all talk to each other, and people, I mean, it's totally word of mouth. As far as getting paid for it, it depends on your situation. So in a private dental practice that sees a lot of patients who do not have special needs, it's excellent marketing. Because when I am able to take care of so-and-so who has a disability, now all of a sudden it's like, well, I've been afraid of the dentist for a while, and maybe I want to see you. And then dad's like, well, I haven't seen the dentist for a while, so I want to see you. So it's almost like a marketing tool. And people go out on a limb and pay so much money for marketing, when if you say one special needs patient, you're going to get their whole family if you have some success with them, because that whole family now is in love with you, and you're like the best dentist in their eyes. So that's not how my practice runs. My practice is more focused on special needs, and so I don't see a lot of the families. When I'm doing at the health center, I see a lot of the families coming in. At the health center, people are more paid on a salary, and so it doesn't affect my personal income, but it does recruit patients into the practice. So for a private practice, I would say you're probably not going to get paid a whole lot for your services with these patients. It depends on your state and how the Medicaid coverage is. A lot of what we do preventative, and a lot of preventative isn't covered very well for adults. We can't even put varnish on in our state. Like, fluoride is covered, but not varnish. So every day that I file in my little claims, like for my case today, if I put varnish on, I'm going to have to file that I put varnish on, because I never lie on the EOB. So I send that in, and then they send me back a denial. But if I would have put that I put foam fluoride on their teeth, then I would have gotten paid. So there's a lot of antiquated systems and a lot of revamping that needs to happen to make that be, and we're working on that. We're working on trying to get those systems to where you can get paid to do preventative focused things in this disability population, in long-term care facilities, and hopefully for adults as a whole. But those are our two key focus areas. So reimbursement wise, it's really not awesome. Marketing wise, it really is awesome. If you're in a health center where you're on an encounter-based system, you know, you can get a lot more done. In my private practice, we're not a not-for-profit, because it's too expensive to be a not-for-profit. Like, to pay an accountant in my private practice, it wouldn't work out, because I pay the accountant more money than we would make. So we're a for-profit business that doesn't make any money, but that's how I run it. You know, I mean, I could start seeing patients that didn't have disabilities, and if Medicaid does have some reform, then we would be able to make some money.
Now we have to wrap, but Brooke, any contact information for someone who wants to reach out to you?
I think the best contact information would probably be our website, yourspecialsmiles.com. My email is, I'm sorry, I have not eaten like a single meal today. We have ice cream. I should say this quietly. We have ice creams in the patient fridge, and I took an ice cream, I mixed some coffee with it, and that's literally the only thing I've eaten today. So, Holly, what is my email address?
I'm looking it up right now.
Thank you. I can't look it up because it's my phone, you know.
It's okay. It's yourspecialsmiles@gmail.com.
Perfect. Email's another good way. Calling me is you. Like, clearly I just ignored a call, and that's what I do all day long. So don't call me because I probably won't answer, but if you email me, I will answer.
Thank you, Dr. Brooke, for being here today. Thank you for sharing, Holly. Thank you, Dr. Brooke, for always being personable and available. And we're looking forward to you being at the conference, if possible, this year, and sharing as usual. Hopefully you could bring some of your team. We'd like to thank iHeart Mobile Dentistry for sponsoring this call, this podcast today. We appreciate your sponsorship today. And Melissa, take us home.
There we go. So we love that you listen. Thank you for all the comments and messages that you send our way. Please continue to reach out to Sonya and I. And if there's anything you want us to talk about on future podcasts, certainly let us know. So please continue to like and share and listen to the podcast and leave us a review. Till next time, thank you for listening.
Bye.
Thank you for listening to Dentistry Gone Wild, the official podcast for mobile and teledentistry. You can subscribe to our channel wherever you listen to your podcast. And if you're enjoying the show, please leave us a review.